Um, been joining via Zoom. And there are a couple others who had to be absent today. But you've been introduced to me and Cameron, Lena, Liam. I always want to get this correct. Natanayashi is right there. And then we have Heather Jason, a long-standing member, recommending two. Welcome. What I'd like to be able to do is, is adopt the agendas of those committee members who are here. Can we, get a motion to adopt the agenda? Okay, Lena, let's make that motion, get a second. A second. The camera, Cameron seconded. And some things we can table until, I know Monique's book there at about 10 o'clock. And so all of that will be. And then what I would like to adjust is moving the minutes after presentation. And then we will go from there so that we can get through. We need to be done with everything that we're doing tonight by 8:20. So, but I believe that we're not gonna take anything away from the 1727 MCB9 presentation. The way I added it up, we have about 20 different things that includes questions and all. We might have a seated, we'll just have to make sure the other presenters stay on time. What I'd also like to do right now in terms of announcements is to congratulate Heather, Jason, Lena, Nepomnia, beautiful, and Liz for their participation in the Columbia University Urban Medical Center's Project Medical Education. It was a wonderful day. They all said so. I don't know if you just quickly want to, 2 seconds, say something about this experience.
Sure. So it's just the Columbia Medical Center puts on this full day event for community members and people that they want to show off their community engagement efforts. So across all of the different schools, School of Dentistry, nursing, physicians and surgeons, and in the medical school, and kind of showing us everything that goes on. It's very cool. Lots of different labs, lots of really interesting stuff.
And I think I gave a certificate.
Yes, and we graduated.
Yeah.
Diplomas, and there was like a reception. Yeah.
Oh, and plenty of food.
There was
plenty.
great. It was very sweet.
And then Heather, you want to just add something, but I know that you said enough that you really, felt the same.
It covered it right on. It's about that was good too. And just seeing the facilities and real life experiences with the existing medical units and who realize their relations. Emergencies that can happen in a nurse's purview was extremely interesting, and being able to look at lab specimens such as the brain and understanding how it relates to disease states such as glioblastoma. So it was really important.
Well, thank you both, and Liz, who's not here, for attending. We really need that representation, and you provided it for us, so thank you very much. Now, there's this November is National Diabetes Month, and what was emailed to you, at least to a number of people in the committee, a calendar of events related to that Dr. Edwin Torres sent out to us. So there's so much to learn about diabetes, and we know that in our area, in our district in particular, there's a real need for endocrine information and professional, providers. So this was important for him to extend to us so that we would be informed, and so those of you who didn't get it would like to just email it to me, but I did send it to the committee and to a bunch of other people who are part of our, email. So those are a couple of things. There may be a couple other announcements that come up, but I want to, hand the floor over to, Canva so he can introduce, a group that is invited to join us. And we're excited to hear more of, what they have to say. So Canva, if you took it into that.
Sure. So for folks that, and can everybody on Zoom hear me all right?
Yes, we can.
Okay,
All right, awesome.
good.
Um,
Oh, wait a minute. Edwin has his hand up and Edwin?
Yes, Laquita, I was just gonna enhance the announcement and thank you for sharing it with everyone. So for the month of November at Montefiore Medical, Montefiore Einstein, we have many events throughout the month. We have about 42 sessions throughout the month, educating the public on diabetes. On November 13, we are having a panel with a nephrologist, a urologist, and an endocrinologist to speak about diabetes and diabetes prevention. And I'll share that with the chairs of the committee so it can be shared with us in the community. And it's a very important topic because diabetes affects, you have in the US about 10% of the population, 338 million people that have diabetes, and then about 96 million have pre-diabetes. So 1/3 of the population have pre-diabetes, and it is a disease that it can be prevented um, or delay, and we can delay also the complications. So very important to disseminate this amongst the people that don't have diabetes, those who have it, and even those who are dealing with it. They can learn how to prevent these complications at whatever stage in the disease they are.
Thanks, everyone. Appreciate it.
And if you don't mind, we do one other thing since I'm listening, watching the, Zoom list. Our board chair, Victor Edwards, is on, Zoom as well. And I don't know if Victor will say something now or as we get into questions and all, but I think that's it. You think
All right.
he'll come back?
So I think we'll start off with, we have a presentation on Legionnaire's disease. So for folks that, may or may not have been aware, this summer there was a Legionnaire's disease outbreak in Harlem. I think it sickened more than 100 people. I think it was more than at least 7 or 8 people that we know of that the health department has publicized have died of Legionnaire's disease this summer. And there's some legislation that's been moving forward, in response to this outbreak. But what I wanted to do is I wanted to invite an organization that has been working on this outbreak and working on protecting the community. So I wanted to introduce a couple of members of the Harlem Legionnaire's Task Force. So that's a community organization that was founded in 2025 in response to the outbreak. Mission is to conduct comprehensive research and community outreach to support the implementation of best practices to substantially reduce the recurrence of Legionnaire's disease outbreaks through education, transparency, the expansion of regulatory compliance, accountability, and enforcement. And so I think we have a couple of folks from the Legionnaire's Task Force on right now. I see Kim Smith, I see June Moses on. So I think we'll give folks, it's 6:45 right now. We're gonna give folks, y'all 8 minutes to present, and then if folks have questions, then we'll continue from there. So Kim or June, who wanted to, I guess, come off mute? Go for it.
Hi, my name is Kim Smith. I'm a founding member of the Harlem Legionnaires Task Force. We formed in August the 23rd, as a result of the outbreak, the lack of information, the lack of transparency. If you can imagine living like really in the center of the outbreak, June lives literally across the way from Harlem Hospital. I'm sandwiched in between two of the other contaminated towers. And it took them weeks. When I say them, the health department, the mayor's office, they were not transparent with the elected officials, definitely not with the community. So as we started getting piecemealed about what was going on, I was like, we have to formulate, we have to do something to first make sure that we're getting concrete information. And then how do we work in a way to mitigate this from occurring again? Every time we meet, it's really saddening to know that 8 people passed, 117 people were ill, 90 were hospitalized, and all of this was preventable if current legislation that's on the books were followed. A lot of this stuff would not have, like the people would not have gotten ill. And so in our quest to make sure that we're moving in a strategic, logical way, but also being mindful of sharing information with the community, gaining the trust of the community surrounding this issue. There are 6 of us on the foundational board level, and through the 6 of us, we have combined a little over 75 years of experience with working within the Harlem community surrounding housing, surrounding public policy. So we have already been credible messengers, but to now shift into making sure that things surrounding Legionnaires regarding the cleanliness, the making sure that things are followed through. Like one of our concerns previously, every 90 days, then it was every 60 days that the towers were supposed to be checked to make sure that there were no Legionella bacteria growing, that the towers were properly cleaned, because at one point they were dropping the biocide, which is the chemical, like if there's Legionella bacteria. But however, once a year, cooling towers are supposed to be completely drained and then the walls scrubbed. So if you're not doing that process, it doesn't matter how much biocide you put inside of a tank, it's still not enough to prevent the cooling towers from having, so much bacteria where people get ill. And one other point, when we meet with our electeds, because we met with all of our area electeds, community stakeholders, environmental groups, and we keep saying, because they talk about oftentimes when I say they, people that we meet with, oh, the cooling towers. I said, we can't separate it. We have to do the cooling and the water towers because in 2019 in Harlem, in Drew Hamilton, which is a NYCHA complex, they had a outbreak. Thankfully, it wasn't as massive, but still, a lot of the practices to keep the cooling towers clean are similar with the water towers. And then aside from the cleaning and the doing the testing, June Moses, I mean, she's just like on the case when it comes to the whole climate change and the issue of the heat vulnerability index. And once she started speaking to that, we started, doing research. So June, if you don't mind, just kind of share the findings and the conversations we've had surrounding connecting the cleaning with being mindful of us being within a heat vulnerable index area. June? Well, Harlem is in the heat vulnerability index area. So when it's 80 degrees in Manhattan, it can be 5 degrees higher. And when we met with WEACT, in some instances, we were told that it can be 10 to 17 degrees higher. So imagine one of the factors that causes the Legionella bacteria to grow, it's the heat. So starting in April, normally, the towers are supposed to be tested. And we found out through research and, some articles and stuff that we read from 2017, there's been a lull of testing because unfortunately, DOH, they didn't have the proper number of inspectors to make sure that they can go around to test the cooling towers, which it's close to 5,000 cooling towers within the 5 boroughs. And so with that being said, so that you have the issue of trying to start testing the towers in the month of April, May, June, July, like during the heating season, and then being mindful again, our temperatures on these cooling towers on the roofs can be anywhere from 5 to possibly 17 degrees higher. So that's definitely a huge concern. And how can we do like kind of create a tickler? When we met with one elected official, we talked about, because we know the issues of the heat vulnerability index, maybe set up a system like when we see the weather, because sometimes in April the weather can get kind of hot, like an early summer. Can we have some type of tickler system where when we notice that, okay, for a week it's going to be warmer than usual in April, to start that testing, to make sure that the towers are being tested, you know, in a timely manner, and then ensure that once the towers are tested, that we have a reliable mechanism to ensure that if a tower is contaminated, that it's properly reported. Because still, building owners, they're required to test, to report, but it's really like, it's an honest system. So if somebody's cooling tower on the top of their building is contaminated, if they choose not to report, it's like, oh, well, like what happens with the residents? So with some of the legislation, like with Senator Claire, she has 3 pieces of legislation. Our assembly person, there's 2 pieces of legislation. As you know, the city council passed something that was very similar to past legislation. And we just keep saying the legislation is great, but if there's no way to ensure, there's no enforcement, there's no way to know that at the end of the day, things are being reported and in a timely fashion. Because currently with DOH, MH, when a tower is contaminated, it can take 6 months for it to be uploaded to their system. Buildings that have reported that their towers were contaminated. And then what does that do for the residents that live in the building? One of the buildings here in Harlem, their tower was contaminated and they weren't even notified. They found out when the news report came out and listed the addresses of the 12 towers. So we're just really trying to stay on top of the issue, because again, this is a disease outbreak that's easily prevented with enforcement, transparency, accountability, penalties, but we're hoping it doesn't, get to that. And in an effort to kind of do some informational feedback, we're doing a Harlem Legionnaires town hall meeting. It's scheduled for Saturday, December the 6th. So the doors are opening at 2:45. We start at 3 p.m. We're going to have a few panelists, from the medical field and some other areas. And then we're going to have just a time where we're receiving information and then disseminating information. Possibly a couple of people that have endured the outbreak, either themselves or a family member that may have been, because we've done so much. We say to ourselves, we've only been working as a task force for 2 months, but yet because of our passion and love for our community, we've been able to accomplish so much. So we didn't want our town hall meeting just to be, a bunch of people sitting at a table, spewing stats, but we want to be able to hear from the people. Like, what do you want to see? What do you think may be some best practices? Because oftentimes, the community, we have our thumb on the pulse of what's going on. So to be able to get some information from the community as well. And then when
Can you hear me?
yes.
We're gonna have to.
We might have to cut you off, but we're gonna pivot to questions if folks
Oh,
have
no
questions.
worries. That's fine. That's fine.
Yeah, no problem. So I want to open it up to questions if anybody either on Zoom or in person has any questions. And I'm sharing your flyer right now on
Oh,
my screen.
thank you. I see. Thank you.
The flyer's very, very nice, and I would just ask if you have or maybe Cameron could share it so we can get it to the
Yeah,
district
I
office.
can share it out to everybody.
Okay, and then specifically to our committee too, because we may have our individual mail outs. But it looks very nice. And then also, we are planning a vigil that has not, when I said the health committee, along with our board chair, we've been talking about a vigil. Maybe there's some way that timing, December 6th, whatever, can we talk and then
Yeah,
we'll get together
we can probably get together offline and talk about like,
and see how one might be able to access the other.
That
And
would be
give
great.
Addition to those who have passed because of Legionnaires.
yeah, I think
That would
Edwin
be
came off,
beautiful.
absolutely. Edwin, you came off of mute?
On the
Yes.
vigil.
Oh, but the chair, Victor, has the hands up.
All right, we'll do Victor and then Edwin.
Victor?
All right, Edwin, it's all you.
I know it takes a little bit of time sometimes to get it up mute. There you go, Victor. You go.
Okay, good evening all. Thank you all to the guests who have arrived and to the committee and members. And thank you, Edwin, for putting the word out. Question for Ms. Smith, I believe it is, who
Yes.
just presented. Thank you
Yes.
so much for attending. And I'm Victor Edwards, the chair of the board. I've done some work with State Senator Claire regarding this. And
Mhm.
I just had two quick questions. One was, do we find that enforcement and compliance is different in our neighborhoods as opposed to other neighborhoods throughout the city? Because I've noticed that the recent outbreaks have been in Harlem, South Bronx, and communities of color. So I don't know if any research or stats have been put together on that topic.
Well, it appears to be. We've done some preliminary work, and I've also reached out. I'm an alum of Hunter College School of Public Policy. So I've definitely reached out because, you know, Hunter College is in a very affluent neighborhood, but not only just Hunter, other neighborhoods on the Upper East Side, the Upper West Side. It seems as if not so much enforcement is different, just the level of the property management companies and the owners and the residents, making sure that things like they're complying with what the regulatory compliance is supposed to be. So it was at the end of the day, I believe it was in 2017, but 2017, there was an outbreak in Lenox Hill, that's the Lenox Hill area. And thankfully, 7 people, and when I say thankfully, that's a very low number. 7 people were ill. And unfortunately, 1 person passed. That's a lot, but that's a huge difference. So at the end of the day, the type, and it's similar to what we deal with when it comes to housing in a lot of urban areas. Not slum-like conditions, no proper heat, hot water, repairs slow to get done. It seems as if that's replicated within this whole process regarding making sure that the towers are properly cleaned and whatever needs to be done. And that's one of the recommendations that we're working on. Like, how can we utilize the information that we are compiling to make sure that the community, like your building, like, is there something posted in the building to say, okay, last month the cooling tower was tested, something where the residents will be informed if these new compliance recommendations or legislation, if they're followed. So it has to be a multi-tiered process.
Gotcha. Thanks so much.
Victor, you had a second question?
No, she answered both at the same time. Thank you.
You're welcome.
And I think I also just to piggyback on what Kim was saying, I think it's also important to mention that with this most recent outbreak, the buildings that were found to be responsible for the community spread of the outbreak were city-owned property. So I think it's, we can talk about like different levels of maintenance and deficiencies and among sort of property managers and building owners, but I think there's definitely a need, and I think this is something that the task force is also trying to address is, the need for like enforcement of, the maintenance requirements by city employees. And city agencies to ensure that, Harlem Hospital is not itself a spreading site of Legionella. And other city-owned buildings.
Right.
Yeah, any other questions, either on Zoom or in person?
Yeah, we're good.
Edwin?
Yes, thank you. Hi, Ms. Smith. Thank you for
Hi.
the presentation. I just had a question in regards to the duplication of services that we see in the community. Here, we have the Health and Environmental Committee. Some of our elected officials, they were on it. How different is the task force at addressing this issue? And when we speak about research, how is that research going to be disseminated for the community to digest, right? Because there's two things. We want to make sure that one, folks are getting sound scientific information that is the standard of care, because we also don't want to alarm folks. And because look, what happened, this should never happen. This is 100% preventable. And with DOH and the chairs here, the chair of the committee, the chair of the community board, Victor Edwards, we were, they were pretty tough with with DOH, because a lot of times in the community there's a lot of replication of the same effort, and we have to have a hub, because then that kind of like lose the message.
Well, firstly, I always say I don't know if there's a lot of replication being done surrounding this area of Legionnaires. And if multiple people are working on something regarding Legionnaires, I welcome it. And then at some point we can all get together. For instance, We Act is fabulous. They've been working on this, but we did not count it robbery. Like immediately I reached out to We Act. I was like, hey, we need to meet with you guys because we need some guidance and we need some, and they welcomed us like something this big, this ominous. For me, it's a good thing that more people would want to become involved, and it may not necessarily seem like it's being replicated, because like with We Act, for instance, they do like a nice macro level of the implications regarding the Legionnaires. We're more micro, the community level. And regarding receiving scientific information, you're absolutely right. Like, we have one person that's a researcher, like an official researcher. Like we have people that's pulling information together scientifically, but however, we're always mindful of our audience. So yes, we'll have, a briefing, or we can do some type of peer-reviewed article that we can put together, but we still want to make sure that as we're sharing the scientific information, that it's understandable and it's not going over someone's head, but it's at a level. So I always call it the buffet analogy. When you go to a buffet, I may be a vegetarian, but I have vegetables. You may be a carnivore. At the end of the day, there's something there for everyone. So we're very, very mindful as we're doing our research, going different places, sharing with people, and we go to unusual spaces. We went to a comedy club and we were able to talk about Harlem Legionnaires. Like we're really trying to be creative, but in a way where it makes sense so that we can bring more people to bear. So I hope I answered your question.
Yes, thank you. And I think that
Okay.
I would say, to continue to bring that information to the CB9, because they have been
Absolutely.
champion here at this, Legionnaires.
Absolutely.
And June, you had your hand raised, and I think this will be our last question, and then we'll have to move on.
No, it's not a question. I just want to thank my colleague there, Kim Smith, for doing a great presentation. And I just want to point out that although our electeds have moved fast in passing local legislation through city council, that's legislation that's been sitting around gathering dust for 2 years. And it doesn't necessarily apply to this specific cluster. And I think that where we're coming from with this is really getting to the granular level and making sure that people understand all the different nuances. So because we can't assume that people don't understand, because I feel like for me, a lot of the miscommunication came from people assuming that the public isn't bright. And it came off a little disrespectful, and it only led to people being misinforming one another. So we're just trying to ensure that not the board of the Department of Health did what they did, but if they had laid out more of a process so people could manage their expectation, we may not have ended up here. So I don't think it's more about replicating, it's more about being the icing on the cake and bringing it all together. Thank you.
Thank you.
And I think that's a really important point to make is that, none of y'all are, professional legionnaires, water scientists or data collectors or anything like that. You are just sort of concerned community members and citizens who are doing this because you care about like the safety of your community. So I think, we should definitely be holding our public officials to, I would say like, the same if not a higher standard of how they should be disseminating information to the community. So definitely commend y'all for the work that you've done so far. And I will definitely distribute the information about the town hall to everyone on our mailing list so that
Yes.
whoever they can come out.
Thank you so much, and I hope you guys can come. So we're gonna have the town hall will be at the A. Philip Randolph Center, and we will also be simulcasting via Zoom. So if people can't make it to the community location, you can definitely sign in via Zoom. So we will be sharing that information, the closer that we get to December 6th. And we started doing our outreach so early, November 1st, because we want to make sure that people are aware and not doing the usual a week before an event, people trying to scurry and get the word out. We're very committed about making sure that people receive information in a timely manner. And if you want to reach the Harlem Legionnaires Task Force, please email us at Harlem, L like Legionnaires, T like Task, F like Force at AOL.com. That's Harlem LTF at AOL.com. And thank you so much for having us.
Yeah, feel free to put that in the chat.
Yes.
Thank you. Yeah, thank you again, Kim.
Yes, no worries.
And we will, I think, move on to our next presentation. So I think we have, we're talking about the ULURP for 1727 Amsterdam. I think Joy was the person that I was in contact with. We have a lot more people than Joy in the room. So I think we'll invite y'all. I think we only got 4 chairs, so whoever wants to come up. But yeah, I'll invite y'all to start your presentation. I think you already have sort of your screen enabled.
May I make a comment as you're coming up? In the interest of time, I know you have a lot to say, but make your important points succinct so that we have a chance to ask questions.
Yeah, I think.
And we have to be, the reason I'm distressing it, I got 2 notes that we have to be out of here. Plus we have 3 other presentations, but you're very important to us and hearing. So, I think, think in terms of 25 minutes, but we, also have questions.
Yeah, and I think most of the folks who, are community members may have already heard like, the previous version of this presentation. So I think if we could focus on, sort of addressing questions that came up during previous presentations, I think that would be probably the best use of our time.
Right.
We've kind of slimmed down the presentation from the last one we saw it. And Agatha and Kyle will be presenting, we're here to answer questions. But it's more focused on the issues applicable to this individual.
Okay, sounds good.
And you're gonna have to predict, because as you hear the train, we have that visitor every few seconds.
Okay. Can everyone see and hear me? Okay, so. I'll try to be loud. I'm soft-spoken, but I'll try to be loud. So my name is Agatha. I work for the Department of Housing Preservation and Development on the Manhattan 118 team. And I'm joined here this evening by my HPD colleagues, also representatives from our development partner on this project, BRC, and also representatives from Health and Hospitals, and everyone will introduce themselves throughout the presentation or later on during the Q&A. But I'll let Kyle introduce himself since we're co-presenting.
Yes, hi everyone, my name is Kyle Jeremiah, I'm BRC's Director of External Affairs. I want to take the opportunity to introduce my colleague Lillian Contreras. She's our VP for Housing Services. So if you have any specific questions related to our social service supportive services, we'll be happy to address all of those questions.
And as mentioned earlier, we're here presenting as part of the ULERP process. It's the public review process, and we're here to hear your feedback on the Hilltop Apartments project, and I want to thank you all for your time. So our agenda for this evening will be as follows. I think most people may already be familiar with this project, but we'll provide a brief refresher, and then we want to focus more on the supportive housing component of this project. So the proposed development will be constructed on a city-owned lot in the Hamilton Heights neighborhood, specifically block 2060, lot 1, which is currently utilized as community facility space. The existing building is beyond its useful life and in need of redevelopment. And the applicant for this ULERP application is HPD, and BRC is our development partner working with us on this project. This project certified into ULERP on September 15th, which officially began the public review process. And given the standard ULERP timelines, this project is anticipated to complete ULERP in spring 2026. And the new 9-story as-of-right building proposed under the Hilltop Apartments project will include approximately 200 units for senior supportive, and low-income households, of which approximately 120 of those units will be supportive housing units, plus 1 supers unit. And these supportive housing units will be filled in conjunction with health and hospital patients who are both eligible clients of the Department of Homeless Services and Health and Hospitals. The proposed development will also include replacement community facility space that will be improved for the Emma L. Bowen Community Service Center, which Kyle will talk about later. And this development is financed and will be developed under HPD's Supportive Housing Loan Program, otherwise known as HLP. And the AMIs for the non-supportive housing units will be affordable to households earning up to 60% AMI. We also want to note for the non-supportive housing units, tenants will be able to use their rental assistance vouchers to fill any of the AMI tiers. And to facilitate this project, the HPD is proposing the following land use action: a designation of the project as an urban development action area, and approval of an urban development action area project, otherwise known as UDAP, and the disposition of the development site. So moving on to project background, in August 2019, HPD designated BRC to develop 1727 Amsterdam through its supportive housing request for qualifications, which was a call for qualifications to form a pre-qualified list of developers with expertise in supportive housing to develop supportive housing on city-owned sites. And BRC was chosen off this list to redevelop the development site based on their impressive track record delivering supportive housing, which they'll speak more in depth to. Since their designation, BRC has conducted several forms of public outreach surrounding the proposed project, specifically beginning in the fall of 2022. Between the summer of 2019 and the fall of 2022, BRC began developing plans for the proposal in collaboration with the ML Bowen Center and HPD. The team also conducted outreach to elected officials during this time. And we also want to acknowledge that there have been some gaps in outreach here. The team has since recalibrated and has come back to the community board since the fall of 2022. And we're also here this evening to hear from all of you and to hear your concerns on the project and to answer any questions. In the spring of 2024, Health and Hospitals began the process of amending their operating agreement from 1969 to include 9 healthcare properties that were previously not included
in their operating agreement, including 1727 Amsterdam. So 1727 Amsterdam is not part of their operating agreement, but they have been managing it for decades. A year later, in spring 2025, council action amended the operating agreement to include 8 of those 9 properties. And as the amended operating agreement did not include 1727 Amsterdam, it's been necessary to provide support to facilitate the disposition of development site under HPD's authority. The project certified in Mueller in fall 2025 is mentioned earlier. We also want to take a second to discuss that New York City is in the midst of an affordable and supportive housing crisis guided by the housing blueprint and where we live plans. The city is working on an ambitious effort to create affordable and supportive housing in the city. In 2024, Health and Hospitals provided care to approximately 80,000 patients experiencing homelessness, half of which were also mutual patients of the Department of Homeless Services and Health and Hospitals. Harlem Hospital alone provides care to 5,000 patients experiencing homelessness. 1727 Amsterdam presents a unique opportunity to provide much needed affordable and supportive housing, along with new and community facility space for the Emma Elbow and Community Service Center. And here's an image of the existing site. The project is located in the Grafton Heights neighborhood, as mentioned earlier. It's located along Amsterdam Avenue between 145th and 146th Streets. It's in close proximity to several historic districts. It's 2 blocks away from the 145th Street subway station and also in close proximity to several bus routes. And I'll turn it over to Kyle to speak more in depth about what's of those projects.
Not too in there.
Yeah, in my, it'll be fun. If you won't spend too much time on this slide, Agatha already outlined affordability and unit mix, but I just want to briefly emphasize that this project will include 200 residential units, affordable to senior supportive, and low income households, earning less than 60% AMI developed under HPD's supportive housing loan program, and 25 of the supported units and 23 of the 40% AMI units will be set aside for older adults. So moving on, in terms of the Emma Bowen Center, they're in the process of relocating at the moment. The cost of that relocation is being paid by the developer, ERC, in the purpose-built space. The new site is at 520 West 135th Street. I understand a few of the board members are toward that space. BRC has worked with Emma Bowen, as Agatha mentioned, for 16 months to design this purpose-built space that would facilitate all of that programming. So it's going to be a new 3-story, 21,000 square foot community facility that incorporates best practices to effectively deliver services to adults, families, and children. They will continue to offer all of their current services in a more efficiently designed space with a comparable rental rate. So the program highlights will include a therapeutic preschool, play and speech therapy programs, rainbow clubhouse, community food pantry, clinical support spaces, and space for administrative and board offices. And so this gives you an idea of where in the community it is. Again, that's 520 West 135th Street. About a half mile from the site. In terms of Heritage Health Center, they've indicated that they'll be relocating to 1649 Amsterdam Avenue, just a few blocks from the current site. So in terms of our neighbor-centric approach, this is not a shelter or transitional housing. We have to emphasize that this is permanent affordable homes with rent subsidized leases. According to the data, 94% of ERC tenants remain housed. Referrals through NYC's coordinated entry system, Hilltop, will focus on DFS and NYC H&H clients. Services funded by NYC's 1515 program and ESSHI. Case management, 24/7 security, wraparound supports. We currently have 1,100 units built and 500 more in the pipeline. slide out, so it's
Could I,
more
could I,
specific.
could I cut that off real quick? I think just because this is like basically the same presentation, that's like,
So this is.
this is,
Yeah.
this is the different part.
Saying something that, you've taken from our comments before and providing new information in terms of how you were impacted
Right,
and took to heart what was stated at the public hearing. Because otherwise it's the same presentation. I think that's what's aggravating people. So just, and then do a Q&A.
so in terms of the questions that we received the last meeting, in terms of the services that you'll be able to offer on-site versus the services that we referred outside. So we're gonna have program service support and operations. So specifically, we're gonna have 10 desk clerks providing 24/7 security of residents and the program staff. They're gonna be monitoring of the surroundings. In terms of program management, of course, we have the admin, program director, assistant director, case management. We're gonna have clinical supervisors, case managers, healthcare navigators, activity specialists. And in terms of facility management, we'll have a facility manager, we're gonna super maintenance workers, porters, etc. So we could just ride through the rest here. Yeah. So we can talk about specifically the on-site wraparound services versus what will be referring.
Yeah, did you talk about those?
Yeah, Lillian, can I invite you?
Sure. One question, I don't know that we ever got answers, and you can answer it tonight. What were the determinants for not bringing back a full service health care center? You did the research and you're talking about our other community partner who we love in Lagoa. But we also have in our district, we have a dearth of full service healthcare centers. What were the determining factors that made you eliminate them altogether in the Jackson or an ophthalmology service? Doesn't have to be them, but not bringing back or having room for a healthcare center, full service.
FQHC.
And an FQHC. Particularly, yeah. What were, and what did you hear? Because I know some of you are new. What did you hear about that? What did you know about that? If you don't know, then, of course, just state it. But we want to know what were the determining factors that said, oh, no, we don't need, this community doesn't need a full service healthcare center. So if you can answer that,
Well, before I ask each and each time, and I'd say that nobody had suggested that the community does not need a full service healthcare facility. I think we recognize that to indicated that they were going to be moving just a few blocks away, so there would be no.
that was after the fact, though.
I-
What did
Maybe
you all
I-
do
Maybe
beforehand?
maybe we could have them finish the presentation, then we can go straight to just questions.
As long as we get to some new information.
Yeah, just, if you wanna talk about the wraparound versus, and then we'll go to just all questions.
Okay, so I'll briefly talk about the wraparound services we provide. Just a background on me, I've been at VRC for 21 years. Currently the Vice President of Housing Services. So I oversee the social services component. So this program, similar to our other programs, is designed to provide stable housing and support to people while being good neighbors and contributing members of the community. So how do we do that? Having staff on site 24 hours. And with the clinical team, the case managers will be assigned 15 tenants. And we call them tenants because they sign a lease. It's permanent housing, they have rental subsidies, so just like any other tenant, they have rights to their unit. So the case managers will meet with them monthly as needed to make sure that 4 components are being addressed. 1, medical and behavioral health services, if they need any referrals to medical and behavioral services, that is being put in place. Entitlements piece, that if whatever entitlements there, whether it be SNAP benefits or Social Security, that they are applying for it and maintaining it. independent living skills, we definitely make sure that they are able to independently live in their units. And then community support. So we definitely encourage them to get involved and become a member of the community where they are. We encourage them to attend community board meetings. We encourage them to attend precinct meetings, to become a voice. We encourage them to seek employment if they can within the communities. We also encourage them to volunteer in the community in whatever they can. But the goal of the program staff and, and the clinical supervisor will oversee the case managers. There will be a program director who will be responsible for the day-to-day operations. But basically to keeping them safe in their units and addressing quickly any issues that might come up.
Got it. And so were there any other sort of new things that you wanted to share in the presentation? If not, then we'll go to questions, but I just wanted to make sure that was.
Yeah, so we have a resident facility from the existing residents if there's time. We hope to.
How long is it? Do you know?
4 minutes, so we can do half of it.
Yeah, let's do half of it.
Oh, okay. It's on another side, obviously.
Yeah, this is across BRC's portfolio.
Where?
So this is
I think it will say in the video.
Okay.
I'm trying to be respectful, but this is so disrespectful. Working class people, especially with families, don't have time to spend hours listening to presentation after presentation. Put it on your website.
I'm sorry.
Allow the public to speak and ask questions. People have already dropped off. It's not fair. This is several years that we're doing this. I have a kid that needs to be in bed right now.
Tiffany, I hear what you're saying. Do we want to just skip the?
Sure, this is publicly
think-
available, we can also share it out.
Yeah, feel free to share that out with
Yeah.
folks and then go straight to questions. I thought that was part of the debate.
Yes, so did I.
It's disrespectful.
So,
yeah,
just to follow up on that real quickly, the question I asked at the general board meeting was, do any of the staff require
And
licenses?
just 1 second, because you do have folks on Zoom who have their hands raised.
Yeah, but since she brought it up, I just figured like it would be the right time, like.
I just want to follow stack, that's all.
Okay.
But we'll get to you. We'll
Okay,
get to you.
no, I mean,
All right,
other questions.
following stack. First, we have Barry, you have your hand raised, do you want to go?
Yeah, I'll try turning on my video. If I get choppy, let me know and I'll turn it back off. So thanks for coming, and I appreciate you guys following up on some of the questions that we've had before. One of the things that Laquita and Edwin, when Edwin was co-chair of the committee, asked 3 years ago was if there had been studies done on the impact to the community's health. And I think Laquita asks that again tonight. One question is, when did you become aware of Heritage's plans to attempt to relocate to the Harry Simmons building?
Might let H&H speak to that, but I know that Heritage did mention at the public hearing that they would be permanently relocating. So that's when we also found out, but I think it would be helpful if H&H could just speak to a little bit of the context here if we can. I know they've been working in the neighborhood for a really long time and are pretty invested in it.
Almost 40 years.
Well, H&H.
Yeah. Oh, hi, everyone. I'm myself a recruiting assistant vice president for government affairs at New York City Health and Hospitals. When we first started with this project in 2019, this is prior to my joining Health and Hospitals. But the team at the time had spoken with both tenants in the building and discussed the plans and kind of the idea of redeveloping the building, at which point Heritage said to us and our team that they would be relocating to this building that they own, which is a few blocks away from their current site. And so that was the time that they shared this information with us. At the same time, Emma Bowen shared that they needed support and some help. And we since then have been working with them to find the support that they need to kind of get to this place where we're at today. In terms of the exact date of that conversation, I don't have that. But this was very early on in the process where we spoke with both tenants, and Heritage told us at that time that they would be relocating to their property.
And we have years of written correspondence with Heritage that they plan to move to 1649 Amsterdam.
And so just to be clear, then HPD found out October 8th and HHC found out in 2019 roughly. So the reason I'm asking is because, 3 years ago, when they asked, what studies have you done on the impact to our neighborhood about moving or interrupting this FQHC, there hadn't been any done. But, when you're disposing of public land or seeking public financing for a project, you have to go through an environmental review. One of the points of an environmental assessment statement is to determine if you need deeper study on any issues. And one of the questions in that EAS is, will there be any disruption or displacement to community facilities, including schools, healthcare facilities, daycares, et cetera? And the answer to that was no. And so
Eric, can I actually correct the record on that? I'm sorry, I just misspoke. We did not find out for the first time at the public hearing, but that's the first time that we heard Heritage acknowledge publicly that they would be moving, but I know they've been in conversation with H&H for quite a long time, including before the EAS was even written. So I just want to make sure that that's super, super clear. That was known and those conversations were ongoing.
Well, then that's actually even more of a question because, no, wait, hold on. Because this community board asked you for 3 years to study the impact of this on our healthcare, and we never got any studies. And in fact, you're required to do them because, and you I'm not going to say lied, but you put a factually incorrect statement on your EAS to avoid having to do that study. And now you're trying to circumvent that again by saying, well, they're moving and it's close, so we don't have to study it. But that's not what the seeker manual says. If you're directly displacing or interrupting a healthcare facility, you have to examine that more deeply, and you haven't. And so you're also supposed to ask the Department of Health and Mental Hygiene for information that may be useful in that. Have you contacted DOHMH about that?
So thanks, Barry, for pointing that out, that was missing from the EAS. We did issue a technical memorandum, which is sort of additional analysis that's provided, that did take a look at both of those healthcare facilities. And that's the map that we showed in the presentation. And because the catchment area, the healthcare facilities are still within that and very close to the current location, it was considered that there would be no loss of services because both of these facilities will also continue to operate throughout the entire process.
Okay, so there won't be any loss, but the seeker manual does say if there's an interruption or basically a change to the physical facility that it has to be studied. And I don't think anyone's contending that it won't be interrupted.
My understanding is that it will not be interrupted, but I don't know if we have more information about that.
Only Heritage speaks to whether or not they're going to be interrupted, but they've consistently communicated their plans to move to 16.
Well, the fact that you guys have had them in court for 2 years trying to evict them suggests that they will be interrupted. And the fact that you have had conversations with them about relocating to trailers suggests you know that they will be interrupted. And so, this is not optional. This is what really gets me so tired, is that just because this is Harlem does not mean you can skip steps and not do things that are legally required. And we went through this conversation for 3 years with ULURP. And here we are. You just gotta follow the law. I'm sorry. So we need to know what impact this will have on people's healthcare because they serve a Medicaid population that is heavily bilingual or Spanish speaking only. And we don't know what's going to happen to them. And if you don't, Heritage is also supposed to provide you or participate in an assessment of how it will be interrupted. So you can't just say, well, Heritage told us they were going to move. There needs to be a timeline. Are there going to be impacts to services? All of these things are required to be analyzed.
And Barry, I think I think Dr. Milano has their hand raised, and I think I just want to provide them the opportunity to comment briefly on, this discussion.
Dr. Milano?
Dr. Milano.
Off of mute. I'm here. I'm off mute. Don't look at my hair. So in any case, in my recollection, we learned about this. I'm very clear on this. I'm working, I'm a physician, I'm the chief of medical affairs. Medical assistants were coming up to me and saying, did you hear the rumor that we're being evicted and that we have to move? No, what are you talking about? And that is how I found out. So your narrative that you were talking to us and we immediately said, don't worry about it, we're going to move. That's a lie. Okay. It's an absolute lie. H&H, don't even get me started. Okay. So in any case, your narrative that you gave about how you spoke to us, baloney, that did not happen. Thank you. That's it.
A response?
Yeah, I'm sorry if there seems to be miscommunication, but we do have written correspondence that dates back to 2019 in communication with Heritage that states their willingness and telling us that they are moving to 1649 Amsterdam. So we do have this document.
She just said it was
And
before
so
2019.
just wanna hold, just wanna maintain a little bit of order, we don't want.
Gotcha.
But I think my question would be, so that we don't devolve into like a he said, she said, is that something that you're able to submit to the community board? That written correspondence to verify?
I would have to check with our legal team. These are all emails, so I have to see what is publicly available, but we do have this.
Let's follow up, and see if we can get that, some of that stuff into the public record. Because I think that seems to be the heart of the contention here is like whether, Heritage like privately was saying that they're okay being evicted, and if they were, then they were, but it sounds like at least the folks that are coming out publicly are saying that they, were not participating in that.
Well, Barry's question was about the health assessment though, and that's still outstanding. I think that's the heart of the matter, right? Is there going to be a health assessment for the loss of services? Maciel de la Cruz was on record in front of the city council under oath, said that there would be no loss of services. That's not true. We know that now at the public hearing, which Agatha and Joy and Amy were so kind to present at, the chair of Heritage said, we have not heard from HHC. We don't know. This is the chair, it wasn't me. I mean, you were there. So it's very difficult to hear these sort of equivocations, these ambiguities, when we have been asking for simple, straightforward responses for 3 years. And frankly, it is not easy to have any confidence or trust in someone who went before the city council and said that we wouldn't lose services. We know what the plan is. The plan is to skirt the community and not to pay attention to us. And frankly, your presence here is not giving us any confidence that you want to listen to us. That is just what I have to say. I'm trying to be respectful because I think the people from HPD have been as professional as possible. But this is a terrible situation that you put us into, and you are not making it better. And I do have questions for HPD. I'm sorry.
No, we're good.
One thing. Sorry.
So do you have a direct response to that?
Yeah,
Okay,
yeah.
direct response, and then we'll go to Karen.
I just want to clarify the hearing that's being referenced was particular for an operating agreement, to amend our operating agreement. It was for the 9 properties that weren't included in our operating agreement. And the question that was asked was, is this technical adjustment going to interrupt any services? And the answer to that is no.
I'm
because-
sorry, the exact question was, will there be any interruption of services at the facility? That was what Councilmember Marte asked, word for word.
As a result of the operating agreement, the technical adjustment.
Yeah, he didn't
And-
say all that though. And you had Heritage in court trying to evict them. Like, explain to me how there's not going to be an interruption when you are attempting to evict and Heritage is resisting.
I'm not trying to turn around. The hearing was around the operating agreement. It wasn't around redevelopment of any of the properties. It wasn't about the future projects that were happening at any of these locations. It was simply to put them within our operating agreement, a technical adjustment, very administrative. There was no talk about projects, the future of any of these sites, which also have projects happening at many of these other facilities. And so when asked the question, the answer was no, and there is no change as a result of the properties being added into our operating agreement. There have been no.
Well, it wasn't added, so.
It was not, correct.
All right, we're gonna go to Karen Asner, and like maybe if folks have, we can come back.
Karen?
Thank you. Hi, I just want to, and these are a couple of, quick yes or no questions, and then I'll get to my follow-up. And I just want to clarify that Health and Hospitals Corporation itself, of the 50 years this building has been there, has never provided any services at the building. That's correct, right?
Yes, yes.
Yes, you have never provided services.
No, we've just always operated the building. I'm Deborah Morrison, Senior Director for Real Estate and Land Use.
Okay,
So
and
the building
in
has been HH's operation since it opened in 1976.
okay, so never provided services, and going forward, Health and Hospitals Corporation is not going to provide any on-site services at the new proposed facility either, correct?
Correct. Correct.
And as I understand it, and I read off Mark Levine's site, that the 120 units of supportive housing are going to house, and I know this from personal experience of family members who live with severe mental illness, that it's going to be 120 individuals who are currently homeless, who suffer from bipolar 1, 2 disorder and schizophrenia. And what I'm hearing you say in your presentation is there's not going to be a single on-site licensed healthcare professional on-site at this facility of 120 very vulnerable individuals who need serious help and care, and that you are going to have a 15-to-1 counselor ratio who are going to meet with them once a month. Am I misunderstanding that, or is that a good, accurate summary? Which I find astonishing, that this is the model, which is not consistent with best practices. It's not consistent with a much smaller best practices of smaller supportive housing components that are integrated into the community. And so if I'm mistaken in what this facility is meant to be, I would like you to tell me, but otherwise I find it very distressing that this is the model.
Yeah, so I said 15-to-1, they would meet at least once a month or as needed. So if some tenants need to meet more, then they will meet more. That's why 15-to-1. And as licenses, all case managers are required to have a BA. We will have the clinical supervisor will have to be a licensed clinician. And then the healthcare coordinator will have their LPN license.
But none of those individuals are living on site at the facility, correct? There's no on-site healthcare staff.
Karen, Deborah Morris, H&H has a Housing for Health program, which provides a variety of housing services, placement services for our patients. And our patient pool is not just people with mental or behavioral health disorders, although they do have patients who have those challenges. There are also diabetics, people with any name a medical challenge that someone might have, that could be our patients. So those, they just happen to also be homeless. So they are someone who has had a health challenge. So they are a mutual client of New York City Health and Hospital, one of our hospitals or outpatient clinics, as well as
dumping ground.
so I just want to correct the type of person.
Well, wait, hold on.
I don't mean to interrupt, but at the public hearing, you said that all 120 supportive housing units would be for people with serious mental illness.
And I'm sorry, but that is, it is Mark.
Guys, we're just gonna bring it back for a second. One thing I just want to clarify this for everybody in the room. This is not a ULURP hearing. This is like the health committee meeting. We do have other folks who are also on the agenda. So I just want to be mindful that for keeping questions, concerns, our responses. Karen, I appreciate it.
I'm very respectful of that, but I also can't let stand. I am also an attorney. People saying information that is really, I believe, to be untrue. You go read Mark Levine's website, his op-ed in the New York Times. He's very clear what his goals are for this facility. You may agree with them, you may disagree with them, you may have views, but that is what he said. And now to come in and say that isn't the case, I don't find credible. So if this is the plan, you should just say it's a plan. And now to say that that's not it on the fly, I just don't believe. But I'm done.
So any direct response to that, or?
Yes, I recall myself saying that the tenants that we will have at this development would be tenants with various levels of disabilities, which can include people with serious mental health disorders, but not exclusively. So to Deborah's point, doesn't mean we're going to have anybody with those challenges, but we can.
All right, so we're gonna go to Andres and then we're
Okay.
gonna go to Edwin.
Okay, so I just want to say a few things, just to start. First of all, thank you so much to the Health Committee for hosting us, and we really appreciate your comment about Legionnaires. I do think that it's sort of emblematic of something similar going on here. Thank you to the people at HPD. You mentioned sort of some inconsistencies in outreach. I think those inconsistencies are present here tonight, and so I have two questions for you guys. One is why H&H? Doesn't the Department of Homeless Services or any other homeless services organization, social service organization, don't they also have residents? I guess I think that part of the difficulty we're encountering is the difficulty with H&H, who's, obviously does great work across the city, but not in this case. So that's my first question. My second question is more sort of like, you guys seem hell-bent on doing this project, no matter what we say or what we think its impact will be on our neighborhood. I read the EAS, there is a declaration about asbestos that says that there is no, well, I guess I would like clarify, like, first of all, what's that question asking? And is the response of no saying that there's no asbestos on site? Because I think one of the problems with the projects done in Harlem is that they are not sort of cared for, followed through. I grew up in southern Manhattan. I've seen how things are done downtown, and I've seen how they're done uptown, having lived up here for 15 years now, and it's not the same. And so having asbestos in the air is a considerable concern, something that would merit further environmental review. And frankly, I think you can tell, right? Our confidence is just like zero in the sort of execution of this project so far.
So two questions. I think the first was like, why, H&H, why not, Department of Homeless Services? Second question, what is the asbestos determination and like, how are you addressing that?
Yeah, so first and foremost, I do want to clarify that these are mutual clients of the Department of Homeless Services and Health and Hospitals. So Health and Hospitals can speak to their Housing for Health initiative, but as we mentioned in the presentation, there are a lot of mutual clients that are both patients of Health and Hospitals, but also clients of the Department of Homeless Services. So I mentioned in the presentation, that's approximately 40,000 people in 2024.
Okay, and second question?
I think
Environmental review.
yeah, I'm not particularly sure what it says in the environmental review. We have to take that back.
My understanding is that would probably be a very technical analysis that was done, and I don't have it in my brain right now, but we can definitely look into that and follow up on that.
And Andres, if you're able to pull it up and talk about what you're saying, then we can come back to you.
Yeah, I have the question here. Would the project result in the renovation of interior existing space on a site with the potential for compromised air quality with either vapor intrusion from either on-site or off-site sources, or the presence of asbestos, PCBs, mercury, or lead-based paint? And the response is no. So yeah, that's.
There's thresholds that are baked into the secure technical manual too. So we gotta take this back. We're not environmental.
Yeah, I hate to say that we're not the experts on that specific thing, because it sounds like we're passing the buck, but we will talk to our experts who can.
Okay, because we are aware of asbestos at the building. It was constructed between 1972 and 1973-4. And so it's just a question about how this environmental review has been carried out.
And can you notice under threshold also? Because I feel like by itself, sure, it might not mean much, but like when it comes to like other quality issues in the neighborhood, that even like if it's below your threshold, that could be something that's like.
So just want to go back to the stack. Appreciate it. Want to go back to the stack. We have Edwin next.
Edwin, and then you.
Go for it, Edwin.
Oh, thank you all. So, when you look at the Manhattan Borough President, I just went online and looked at, because somebody put the link there for 727, right? We've been asking about the community health assessment that was done. And I'm interested in in which, model was used for such. The one that I reviewed from H&H was only done for the entire city, which we're all very aware of. We're very sympathetic because we have more than our fair.
Keep our questions like concise if possible.
But I have to give a background so we can understand where we come from
I'm
here.
just letting you know, I'm not.
Yeah, no, I know, but we got to give a context of the question that we're bringing here, because from what I hear when they respond here, some of the folks here, they just, bypass what we're trying to get at. I want to know which, model was used to get to the community health assessment. When I review the package that was sent to us, this was not done specifically for CB9. And we can look at the need that we have in CB9 to have 3 and 4 bedroom apartments. When you look at this proposal, it's a proportion to 1 bedroom, which, look, if you're looking at the health needs of H&H, indeed, you're meeting the requirement. But now we have Community Board 9 that also has their need. And we have more than our fair share of these, supportive housing. So what was the methodology that you guys use, and which model do you use for the community health assessment specifically to CB9?
All right, so yeah, that was the question. What was the methodology of the community health assessment? Which model we used? How was? Does anybody want to have just direct response to that question?
And specifically to CB9.
No direct response to that question?
We were not sure what health assessment is being referenced.
There's not. I think he's confused. I think he's confusing the environmental assessment with a health assessment. There is no health assessment. There's never been one.
Took on this
So to be clear, when you talk
Yeah,
about
Edwin, you want to clarify? Because I think.
Yeah, so when you talk about a community health assessment, this is a systematic, just like when I diagnose a patient, this is a systematic process that we use to collect data and analyze how it will impact the community. And you need to identify, issues, resources, and then you prioritize them. And there are models that we use in public health to come to that assessment and to that diagnosis and what that community specifically needs.
So, yeah, talking about the model, it doesn't appear that there was a comprehensive health assessment that was done. So I think that's sort of why there's a little bit of silence on this end.
Exactly. So this is very specific as to the need for CB9, which was not done. So how are you throwing this down the throat of CB9 when you don't even know this? It's like me seeing a patient. I never talk to you, and here I'm giving you a medication and say, hey, you need to take this.
Yeah, Edwin, I appreciate that point. And I'm not trying to rush anybody. I just want to acknowledge that we do have, guests in the room who are also on the agenda. So that's why I'm really trying to get us to answer these questions as many as possible. Ewan, go for it. And any other questions in the room that we want to know? We got one, we got two. All right, Ewan, go for it.
Okay, I've just got a very, very quick and basic thing. But first I want to thank my neighbors and others who have advanced these very important points tonight, and being tenacious about it until, we get the answers to these questions. So I noticed in the presentation that the project is being referenced as an as of right project. And I think that's not true. And if this presentation is being, shown around other community boards and city council, that should be corrected.
Yeah. The as of right just means that it's being built as of right as per zoning. So as per zoning, each parcel has a specific.
But it requires permits, and it has to go through a process. And when you say to a layperson like me that a building is as of right, one assumes that there are no permissions and no process associated with it, that, everything is already finalized and you're in compliance 100% and everything is in place. That is how the community interprets that.
Understood. That's totally fair. We're planners. We have a lot of technical speak. So yeah, thank you.
Yes, and that is me. So I think that needs to be corrected. And the second technical speak is, and which adds to the confusion of, residents have about this project, people who haven't been following up on the discussion and may just see a flyer or whatever and trying to take a position on it, is the conflating of supportive housing and affordable housing. They're two different things. And this project is not an affordable, it's partially an affordable housing project, 20%, as opposed to 80%. I believe those percentages are right. Supportive housing. It should be, if it call,
Yeah, could we just get a clarification? on
yeah,
the-
yeah, that's, it should be called whatever it is, but it's not affordable housing. And the bar president keeps saying and to the public, oh, this is not, it's not a shelter. We know it's not a shelter. It's not supportive housing. It's an affordable housing project. But
Any
they're
response to that?
two different. things.
100% affordable housing, and that includes supportive housing. So these are tenants with a lease. All of the tenants in this building will have their own apartments, they will have leases. The supportive component is just that those tenants that are coming through shelter will have additional services available to them should they want, but at its core, this is first housing, and this is permanent housing for all tenants in this building. And the split is 60% supportive and then 40% available to low-income individuals or households. Those units are marketed on Housing Connect, and the supportive housing units are
Yeah,
referred.
okay. Well, the ratio is not, doesn't suit this community, but still, when you say support, affordable housing to someone, they're more likely to interpret it as deep affordable housing, and they would want to favor this project, and say, why is there an argument? It's all affordable housing, but it's not. It's supportive housing. I mean, who pays the rent for they're wards of the city, most of them.
And I think,
And
I just think that's the issue, though. There's a limitation for the supportive housing residents. They are often not allowed to work full-time jobs because
we can
they make too much. So I just want to, there's
It should be clarified. That's all I'm saying.
clarification, though. That's why I bring it
It's
up.
a lot of
You know,
misspeak on
affordable
this
housing question
project.
and gentrification is another issue. I will go into that.
I just want to respect, like,
Yeah.
do you want to, I think you're next.
Yeah, thanks. My question is relative to BRC. Having been selected for this project, supposedly based on your expertise, where do you have a facility of this size and scale and mix in Manhattan or any of the 5 boroughs of this scale that you have successfully been managing and operating and have where?
So we have, we have one in the Bronx, we have a
Top size and scale
apartments at Landing Road, that's 135 units.
of supportive housing of.
A mix just like this, support.
And what is the mix? What percentages?
It's the same thing, 60-40.
60-40, and the total is 130.
135.
The total is 135, not 200. I said this size and this scale, this magnitude, where?
This would be
One,
your
I mean, one of the criteria was for selection of you as the developers for the site is your expertise. How many, I'm an architect, and in presentations to clients prospectively, we have to show comparable projects of that same type and scale. Where do you have a project of this type and scale?
So this project will be our largest project,
It will be your
largest housing.
largest project. So prior to being selected, you had no track record relative to a scale of operating, developing and successfully operating a project of the size and scale. Is that true or not true?
We continue to successfully operate many housing programs.
You may successfully operate smaller scale projects, but we're talking about, we're talking about one of this size.
And I appreciate it, and I think the question, I think it's a good point, and I think it's, it's been answered, that they haven't had a project of this scale to this point. Monique, I think you're next.
Yes, I know at the public meeting I asked this question and I'm gonna ask it again because it sounds like you're coming before us, listening to our concerns, going back and I guess looking at ways to address what our concerns are. One of the questions I had asked was the taking into consideration the residents of CB9s and being given priority in terms of having space in this new facility because the needs here are great, as you heard us talk about. They're very tremendous. You know, number of homeless people who reside or on the streets of the CP. And you have to refresh my memory in terms of how much priority would be given to people in CB9 versus you bringing people into CB9.
And before you answer, I just want to say, Tiffany Khan, I think you're gonna be the last question, then we're gonna close and go to our next
Just
person.
to be explicitly clear, you're directly referring to space that might be made available to CB9 on that.
Right, occupying those units, in this large
Or you mean,
facility.
when you mean apartment units?
Right, so it's 200 units or what have you in this facility, right? What percentage
Or
will be?
we actually get the number of units,
Right.
because I think the percentage feels a little bit ambiguous, like what number of
Yeah.
units when you sort of, you know.
Yeah, we can definitely do that. So, I can't do the math right now, but 79 of the units will be, issued on housing lottery. So tenants, everyone can apply to that on Housing Connect. And then the 120 units will be supportive. For community board preference, citywide, it's 15%, and that came as a result of a lawsuit.
And just to clarify, is that 15% of all 200?
The lottery.
Just the lottery, so the supportive housing will not be CB9 preference.
There will be a lot of clients coming from Harlem Hospital.
Harlem Hospital, but not a specific CB9 preference.
12 apartments.
That's true, yeah.
Hold on,
I'm sorry, what?
12.
15% of 70.
What, 12?
12
12 what?
apartments.
So 12 apartments will be going, or be given, to CB9 residents will be considered for only 12.
Yeah.
No, and that's,
Apartments.
they won't only be considered for those 12, so there's just a preference for only 15%, but CB9ers and could fill the other units as well. They're just not a specified preference and.
I
This is
don't
the
wanna
citywide
belabel it,
policy.
but it doesn't sound like, I mean, given everything that's been said and our concerns, and we're bearing this brunt of, and don't get me wrong, cause we need to do right by, those in the city, but it also look out for those in our community. It doesn't seem like that is being given consideration, and we bear a lot already.
Yeah.
And not taking into consideration the resources that are needed. That
Yes,
hasn't
I
been
have
talked about because a proper assessment wasn't done.
Okay,
So I'll just leave it at that.
thank you.
Cause it sounds like
Yeah.
there's no room to increase that, so greater
Yeah. it sounds like
preference would
there's,
be given.
Like legal, no.
We were
legal-
sued. The city was sued.
And also remind, we have patients that are not just at Harlem Hospital, but there are patients at Sidingham, there are patients at St. Nicholas houses. We have patients at Metropolitan Hospital, there are a lot of patients within CB9. So there's a big pool of potential patients experiencing homelessness.
Okay.
Thank
But
And I just
love
wanna,
to hear.
I wanna really clarify, it's not that we don't wanna give preference to the community board, it's that we legally can't, and that's just, it was a challenge to fair housing law. People wanted to make sure that folks had choice of neighborhoods that they were living in. But I know BRC has also offered to do Housing Connect workshops in the neighborhood too, to make sure that folks are aware of these units and can apply.
Okay, Tiffany?
Okay.
We'll go to Tiffany and then we'll. Your
Okay,
tiny
so
things.
really fast, and please answer as quickly as possible. BRC, how long have you been running that facility in the Bronx that you mentioned was comparable? As
The
quickly
one
as
thirty-five
possible.
unit facility in the Bronx.
Landing road.
About 7-8 years.
7-8 years.
And
All
you
right.
said it was how many units?
135 units.
Okay.
Small question. All right,
What's the,
yeah, go for it, no, go for
what's
it.
the AMI for the 79 units that are gonna go in hospital?
Yeah.
Sorry, what, because you were.
The AMI.
So the slides shows the amount, so
More than 70%. Sorry, I might be reading it wrong.
Okay,
but
HPD, next question. You,
For the 79.
Yes, 40.
So it's,
Is it this?
40 to 60% AMI for the 79 units.
that's 40,
Okay.
60.
All right,
What portion are at 40%?
all right. So
yeah, Tiffany, did you have?
this is a pre-qualified list of vendors, right? How much experience running this type of supportive housing did BRC have at the time that the contract was awarded to them in 2013?
So the question was, at the time that the contract was awarded, how much experience did BRC have running these types of?
So for those who don't know, this is a pre-qualified list of vendors. It's basically fast tracking the application. Supposedly, they have experience providing these services, which is why the application is fast tracked. So how much experience did BRC have in 2013 running this type of facility?
But as of today, we have over 30 years of experience in supportive housing. The question was a similar size, which is 135. That one is 8 years. But other supportive housing programs, we have other programs that we've been operating for over 30 years.
Doesn't matter. Scale.
You said,
Yeah, go
I'm
ahead.
sorry,
Tiffany.
you were breaking up.
All right, so Tiffany, we're gonna have to like stop. So
I
we're gonna
totally
go.
did not hear.
So we're gonna move to our presentation from our community organization.
Thank you,
Thanks
for coming, HPE and, PRC, Health and Hospital. But, you know, we need to probably have some other kind of presentation, but the questions have to be answered. Just answer the question and go into background just doesn't help us at all.
Yeah.
And what I would like to put forward, that you come back some way strictly with what were the determining factors that made you not just to decide not to bring back a full service, well-respected, well-loved healthcare center.
All right.
That's what, and then there was a second thing as well. Yeah, I know, but you know, I also want to specifically thank Barry Weinberg too and the committee for all the work they did in providing us with research and bringing this and Andreas to our attention. And the community board and the communities had to just, you know, pick up speed and, you know, to try to get a handle on what you guys have tried to present to us.
Yeah.
So we're not pleased. I'm hoping we can work something. Yeah, I really do. I hope we work.
All right, so we're gonna go into our WHTC grantees. If folks are comfortable, we're gonna probably have to shorten those presentations pretty significantly, because we do have to get out of here by 8:20. Want to respect Ashley's time. So our first presenter will be the Making It Through program. We have Wendy, from the Making. So we're gonna ask, Wendy, you're on right now?
Yeah.
Yes, I'm here.
All right, so could you do 3 minutes, Wendy? Are you able to give this in 3 minutes of question?
I probably can. I was
right,
going to show
go
you
for it.
something. I will just not show it to you. And I will speak quickly.
Thank you so much.
No problem. Good evening. The Tar Omega Charitable Trust Fund is honored to have the opportunity.
And folks, if you have side conversations, just take them outside. You can come back inside, we'll let you in. Wendy, go for it.
Sure. The opportunity and privilege to present before Community Board 9 Health and Environment Committee for the 4th time as a recipient of a grant from the West Harlem Development Corporation. The grant from the West Harlem Development Corporation had allowed us to implement and grow our Making It Through mental health program for young people. Originally, our target audience was college students to support our mission to assist young people in their educational endeavors. However, each year we have expanded from the social media-based program delivery concept while maintaining our social media presence. The program now also offers workshops in high schools. We recently delivered our Let's Talk 4 workshop series, as well as spent a day presenting to seniors at A. Philip Randolph High School. In addition, we worked with the community-based organizations similar to when we co-hosted with this committee and the Youth Education and Libraries Committee at Graham Wyndham Manhattanville Cornerstone Center in 2024. Outreach to the community during the warmer months has taken the form of participating in numerous community events such as Harlem Week, Hope for Harlem Community Day, Boys and Girls Club of Harlem Back to School event, and Harlem Pride Celebration 2025. Subscribers to our program receive a monthly newsletter with an article illuminating the mental health topic of that month, as well as associated tips and resources. On September 27th, we co-hosted the 7th Annual College Fair with Tau Omega Chapter Alpha Kappa Alpha Sorority Incorporated, where the Making It Through program presented 2 workshops. The event, with over 200 attendees and 30 schools represented, was held at the Lee Bollinger Forum of Columbia University with an in-kind grant from West Harlem Development Corporation. Our most recent program enhancement has been podcast recordings of our host, Nikki Summers, interviewing individuals in the mental health field regarding sexual assault, bullying, and maintaining mental health and coping skills. The podcasts are available on most platforms, such as Apple and Spotify, where you listen to your favorite podcasts. I was going to play one for you, but in the essence of time, I will not. So it's our plan to continue these types of activities during the remainder of the 2025 and 2026 program year. So before taking questions, I will say that on a personal level, I have enjoyed renewing an old friendship with community co-chair Laquita Henry and making new connections with other community members and meeting participants. Attending the monthly meetings, as I did tonight, is always very informative. So I'm glad to answer any questions.
Thank you so much, Wendy, and I appreciate your flexibility. We, really wanted to give you our 8 minutes, but you understand that,
Yes,
folks.
thank you. I enjoy being here. Good night.
Most of our meetings. Thank you.
Any questions for Wendy?
What's the cycle of operation?
Wendy, did you hear the question?
No, I didn't. I'm sorry.
What is the cycle? Like, when do you start?
Oh, from June to July. That's West Harlem Development's program year. So that's when we start.
Got it.
Awesome. Any other questions? Incredible. Thank you so much, Wendy, for your
No
patience
problem.
and your time.
Okay, good night.
Good work.
Good night. All right, next we got City Harvest, Rebecca Silver.
Yes, I'm here. Can you hear me?
Yes,
Yes.
you can.
Great. Yes, I will also just talk through some of my points here, but just wanted to start off by thanking you and the West Harlem Development Corporation so much for the continued support. City Harvest is
Yeah,
yes.
we have 3.5 minutes, just so you know.
I will go very quickly. So we
Appreciate
are
it.
a food rescue organization, and so we rescue food, majority of which is fresh produce, and deliver that to food pantries and soup kitchens throughout the city. We currently have 4 partners in Manhattan Community District 9, as well as our mobile market that's located like a street over from the line. So we do serve a lot of residents there. This year, we're going on track to deliver over 500,000 pounds of food to the district, as well as over 300,000 pounds of food will be delivered through that mobile market. I do just want to also address a lot of the SNAP cuts that are being made. We have been responding and making long-term plans with the SNAP cuts that came out of the OBA bill in July. And with the current government shutdown, it was just announced today, SNAP benefits will be partially funded. We don't know when they will be funded. And so that could be anywhere from days to weeks where those November benefits will be seen. And so we are in full activation mode. And this month we are planning to deliver 1 million more pounds than November of last year in response to the increased need we're most likely seeing. And I will stop there.
Thank you so much, Rebecca. Do we have any questions for Rebecca with City Harvest? All right. Well, thank you so much for coming and presenting and for your patience and your flexibility. All right, and then I think Ryan Health is gonna they're gonna postpone, yeah. Until next month, so they'll come back. They had to go, yeah, they were here. But yeah, so I think we're gonna go and we're gonna move to, can we get a motion to adopt the minutes from the last 2 meetings, September and October? Because I think that's all we have. We have any old business? All right. Way to go. Way to go.
She's not.
Right.
So we make a motion.
Way to, yeah. Anything
Good,
else you
old
wanted to
bill?
share? Old business.
I think,
I know there's the Legionnaires victims, and I think we're upcoming meeting.
then
we're
I
gonna-
mentioned with
Yeah, you already talked about that.
sorry that early on, but it's that we're gonna try, I didn't know the other group on Legionnaires was gonna actually be here, that's why they weren't on the agenda. But, I think what they're doing is great, like Cameron introduced,
Yeah.
someone introduced.
So what are we
Yeah.
doing?
So, yeah.
We don't have a date yet, but
Any
they
other
offered December 6th. Oh, okay.
Okay.
So they offered December 6th, and
Okay.
so I just suggested maybe we can get together.
Yeah, so we'll follow up with them
And
to see if we can do a partner on like something.
Thank you. I was.
And the idling trucks, I think we're gonna try to set aside some time to talk about, you know, some of the
Oh, you
idling
use that.
trucks issue. We'll table that. Need statement, we completed that.
No,
Oh,
right,
yeah.
let me just, I don't wanna run through everything. But the idling trucks issue came up when this one company, thanks to, again, Edwin going out and digging up stuff and then the photos. They apparently, we got some accountability from I think it's DEP. And they went after, the community started sending in or calling in 311. They were leaving their school buses and all idling in our community that has a number of residents, children who suffer from asthma, and then there are other air pollution issues. So they at least, called or contacted Councilman Abreu's office. And Community Board 9 put something on its website in reference to the call. So we need to discuss it and say
On the agenda
for December, yeah.
All right, we'll go.
And so anyways, but that shows that there is some accountability. We have a resolution on that. We have a resolution on so much. But then all I wanted to do with the district needs statement, if we could just take a couple minutes, you all got it. Thank you. Cameron, Monique, Janera, everybody, Liz, all participated in a phone call. We talked. And so we came up with suggestions to add to last year's. So some things remain the same in terms of what we want for the budget. And other things, there are other things we added to, like a request for a new facility. And by the way, the facility, Ryan Health is.
The action items are.
We don't have an action item, but the district needs, we have enough people here. Are you okay? Would you read the new information on the district needs statement? Can we get a vote on it? What we
Feel
did
comfortable voting on the district needs statement at this time?
just to submit to Deirdre and Yutha. We got an extension on it for the 6th, so just read over it. Give me a call if there's something that's outstanding it's due in on the 6th, so I wanna, let's say Wednesday.
All right, call by Wednesday, letter, if there's anything that looks ridiculous.
But look at it, and I only put in these documents items that are related to health.
All right, cool.
Okay, so you turn it on.
Minutes, can we get a motion to adopt the minutes?
So moved.
Seconded,
Second.
okay. And then I think that's it. I think that's all we got. Can we get a motion to adjourn?
I move that we end the meeting at 8:19.
8:19, you did it.
Thank you, President. Second.
Listen.
Yeah, that was. Wow, yeah.
All right, thank you all so much for joining.
Okay, so we're looking at it and setting our
Yeah.
last minute thoughts.
If there's
To
any.
both you and Laquita.
Yep.
Right, okay, did I make sure I sent?
Great job.
Highlight it. Thank you. Thank you.
Great job, guys. Great job. Thank you all.
Yeah, I didn't expect, I didn't expect.
Yes, thank you to everyone on the committee.
Absolutely. Thanks, Barry, as well. Thank you.
What did you
Karen,
say? Oh, I think it's so sweet. How's it, land use? Oh, wait. That's the meeting that I'll go under. So this one, I have to go. Oh, okay. Oh, sit this way. Yeah. If it's not all the next one. Okay, so let's.
I know, but I'm just gonna leave these, the.
Yes, you sent out.
Oh, those are good.
The calendar, but it's also on the website. Go back to that site and see, because also things might be because this week. We have election tomorrow, which I'm gonna get home back through there. Yes,
I am too.
yeah.
5 a.m.
I was grateful that
Are you going?
Hello.
They're both waiting.
I'm looking for three.
Yeah, no, I know. If you do it, unless you. Yeah, listen.
Hey, I love that. I've done it, yeah, but I love that. But I did early voting. I was at the.
Yeah, that's why. Cut them off like way sooner.
You're at a nice place. Oh, we should shut this off. No, where's the mouse? That's what he said. Alright, but I don't know how updated, how you have, I guess, we're done, right? Yeah. Stop. It's so recording. I know it is still recording. Alright, how are you? Yes, right?